Hello, everybody, and welcome to this week's episode on Fit as a Fiddle. I have a doctor on the show with us today. His name is Tony Capone, and he is a retinal specialist. He has many accolades behind his name, including things like the best doctors in America and co-authoring and authoring 300 publications. He does a lot of surgeries and works with the pediatric population and just all sorts of things that I don't even fully know about, which is why he's on the show, because he will be the first person talking about eye health for us to our audience. So welcome to the show.
Thank you for having me.
Of course. So Tony, first, I would love for you to just explain what you do to our audience, and tell us a little bit also about what brought you into this space in the first place.
Sure. So I'm an ophthalmologist, and as such, I'm a doctor who takes care of medical and surgical eye problems within that relate to the eye. And within ophthalmology, there are a number of specialties. So most ophthalmologists are what we call general ophthalmologists. They are kind of primary care providers, take care of everything from eyeglasses to medical conditions like glaucoma and consequences of diabetes that affect the eye, for example, as well as do surgical procedures like cataract surgery and straighten out crossed eyes and things like that. Um, uh, Apart from the generalists, though, there are folks who take a deeper dive, I guess, like any subspecialty. And so there are specialists in ophthalmology in glaucoma, pediatric ophthalmology, eye plastic surgery, and the like. My particular specialty is uh, retina, and kind of for those who may not, know very much about the eye structurally. In a way, you can divide the eye into the front part of the eye, which is largely concerned with things like contact lens wear, dry eye, cataract surgery. So from the tear film all the way to the lens, if you will. And then behind the lens, in the back part of the eye, is the retina. And a good analogy for the back part of the eye is kind of like it is the retina is the film in the camera that is the eye. Um, and then the center of the eye is a hollow sphere and is filled with the jelly that fills the eye. That's the vitreous gel. A lot of folks kind of remember from high school bio the kind of silly term vitreous humor. So the vitreous and the retina are largely the things that I take care of as a retina specialist.
That's awesome. So firstly, also genuine question, what is the difference between an optometrist and ophthalmologist?
Yeah, that's another good question. In general terms, so first of all, they sound so much alike, I think it's hard for people to distinguish them. And both are eye care providers. And so I think a good way to think about it is as a spectrum, if you will. Um, a lot of kind of frontline uh, general eye care, and largely, but not exclusively, for folks who are healthy but need contact lenses and glasses and things like that are provided by both, but optometrists tilt more towards that end of the spectrum, and ophthalmologists will tilt more to the certainly the surgical end, and then the more complicated medical issues. So that's the difference in what they do. Both of them go to college for 4 years. Optometrists have a 4-year degree in optometry and are conferred a doctor of optometry title. Ophthalmologists will go to medical school for 4 years and then do an internship and then a residency in ophthalmology, which sums to another 4 years, if you will, after medical school. And then if they desire to specialize further, like I did in retina or in cornea or something like that, you'll do another 1 or 2 years. So they're care providers on a spectrum, and there's a difference in education of anywhere between, say, 4 to 7 years, depending on the specialty, betwixt the two. And ophthalmologists usually at the more severe end of the spectrum, but you can get your glasses at your general ophthalmologist as well. That's a place where they overlap and things like that. So
Yeah, so a lot more involved cases and obviously on the surgical side of things.
Exactly.
And I'm sure you're working with people who have, some complications of other like car crashes or, car accidents or like other like facial reconstruction kind of things as well, I
That's right.
assume. Do you
Yep.
work?
So trauma is one of the, will definitely tilt more towards the medical surgical side of things than towards the optometric.
Got it. Okay. So now I want to kind of delve into what you typically do on a day-to-day basis because it sounds like something you might do is just do a general checkup of someone's eye health, and then you might also be going into the OR on the same day to do something really invasive in terms of an intervention. So what does that look like for you?
Yeah, that's a great question, actually. And ophthalmology is a little unique in that regard. So, as I know you're aware, medicine kind of is divided into medical specialties and surgical specialties. And even the internships are different, right? People going into internal medicine do a medicine internship, and people who do surgical specialties tend to do a surgical. That's that first year where, commonly popularized in television shows, right? Um, Ophthalmology is one of the specialties that really combines both worlds. We do both medical and surgical care of eye diseases. So what I do on a given day depends on the day. So if it's an office day, I'll handle folks who come in for medical treatments. So patients with diabetes who have problems with the retina that can impair vision can be treated either with a laser or medicines that are injected in the eye, and we do those injections in the office. Macular degeneration is another condition that can be treated with injections. If the disease is severe, that's done in the office as well. So regular office visits, lasers, and medical therapies are done in the office. Conversely, on surgical days, we're in the operating room and fixing things like retinal detachments, hemorrhages in the eye, trauma, as you suggested, complications of diabetes, and things of that nature. So what's done depends on the day, and it's both medical and surgical
What do you like
issues.
doing the best?
That's a great question. The most creative for me is the operating room. You had a set of skills, and then you enter the eye, and the problem presents itself, and you can choose, the image of either, the sculptor artist or the ninja, but whatever, and like it's a battle. But you take your skills and you kind of have to be very, very creative, and you really kind of get a sense of the art of medicine, as a surgeon. The office, on the other hand, obviously because, patients are much more fully awake, that's where you get a lot of the sort of relational fun, of being a doctor. That's when, you get to know people, get to know their lives, get to know what their issues are. And so they kind of each do different things or provide different satisfaction. And in candor, I like a mixture of both. I wouldn't want to be a surgeon 5 days a week or 7 days a week. And a full office of patients. Retinologists see a lot of patients in a given day, not uncommonly, you know, 50 to mid 60s is pretty common. That's a lot of folks. And to do that 5 days a week is a pretty heavy lift. So variety kind of makes the week go by in the most fun way.
Yeah, I imagine you can't really talk to the patients you're doing your surgeries on. So those are
No,
quiet days. You
no,
get to rest your voice.
that's
And
right.
then the 60 patients the next day, you can talk all you
Yeah,
want, I'm sure.
yeah, that's when you get chatty.
I love that. And just getting to know you in the last, I don't know, half hour or whatever it is, I can tell that you probably have wonderful, wonderful patient care when you're talking to your patients with education and explaining things to them really well and being able to answer questions. And as a PT, I love doing that. I think that my favorite part is not like necessarily putting my hands on a patient and like trying to fix something, but just telling them because that's when all the light bulbs go off and they're like, oh, okay, cool. I didn't know this or I didn't know that. Speaking of which, what are general things? I mean, honestly, I'll tell you, I have contact lenses. I've worn them since I was probably like 15 years old. And I'll tell you a funny story of why I even knew that I had any kind of problem with my eyes. I was actually like sitting in the front seat of I think I was like a sophomore in high school, And I had a really silly teacher who we always used to like joke around. And I had asked the teacher, like, why did you write so small? And he was like, what are you talking about? I was like, you wrote so small. I can't read what you wrote. And so we were just going back and forth. And the whole class was just like kind of doing what their own thing. They're in like some group project. I was like, can you write bigger? And he's like, I think you need to get your eyes checked out. And then that was it. And I was like, oh my God, I have to wear glasses or contacts. Oh no. And I was like, oh, my life is ruined. My eyes are messed up. I was being silly. So then I went to the optometrist, I believe at the time, who was nearby. And then they just told me I got like a pair of glasses and I got contacts as well. And it was great. I've worn them since, and I really don't know anything about my eyes other than wear your contacts and
Mhm.
put them away after 8 hours and wear them only for 2 weeks. That's it. So, because I have a wonderful specialist in eye health, I'm just curious, what is your best practices for people who have like minor eye things, like, they are just nearsighted or farsighted and they just have some level of lens that they need as help?
Yeah, I think kind of the for folks who are otherwise healthy, and I include in that people who need glasses, and kind of this is a place where sort of the general public uh, I won't say conflicts, but there's a difference in perspective. From the physician perspective, you may need glasses, but if I can get your vision to 20/20 with glasses, then I consider you healthy. So just requiring glasses to see for most folk doesn't mean that your eyes are unhealthy. It's kind of, you know, uh, uh, because whether or not you need glasses in general terms just relates to, whether your eye is exactly the right, length for the power that's within it, or maybe just a little bit too long or a little bit too short. And when you think about it that way, it's sort of be analogous to having like a perfect shoe size. And so the fact that you require like a half size bigger or a half size less doesn't mean you have a foot problem, right? So for vision, it's the same. As long as we can get your vision to the right spot, whether you require, glasses or don't, then largely we consider your eyes to be healthy. So for most folks, general eye health is just that, making sure that you see well, and and then mostly preventive things, like if you're in situations that can put your eyes at risk of injury, being deliberate and mindful about that. So folks who use, high speed tools, who do car repairs, protective eyewear for risky circumstances. That's another sort of general eye health consideration. We're commonly asked about nutrition. And, frankly, in the States where virtually everything we eat is fortified, it's quite difficult to be vitamin deficient, as opposed to parts of the world, for example, that subsist largely on bleached rice because it's inexpensive. Bleaching rice takes all the vitamins out of it. So vitamin deficiencies are a big issue in, low and middle income countries, but are not generally issues in the United States unless you have some sort of some medical condition that impacts on vitamin absorption, or folks who are on highly restrictive, unique diets, can also become, vitamin deficient. But by and large, if you eat a balanced diet in the United States, it's very difficult to be vitamin deficient because there are so many initiatives that have taken place to make sure that we are vitamin sufficient.
What vitamins do you need to have proper eye health in the first place? I genuinely don't know.
Well, an important one is vitamin A. Actually,
Okay.
that's the one that kind of hits people the most. So again, uh, so here's a little interesting sidebar. When I finished my training, I did a little sort of philanthrotourism. I went to the South Pacific and visited some islands with a good friend of mine. We did a little bit of surgery and also, some snorkeling and things like that. And on one of the islands that previously the population has subsisted on a very healthy diet of fish and breadfruit and so on and so forth. Once the island became, westernized, if you will, they drifted away from their native diet, and those who did not have the means tended to subsist on bleached rice, largely, and so they ended up having, vitamin A deficiency. And the two major findings or problems that can occur with vitamin A deficiency are dryness of the surface of the eye and also problems with night vision. So cornea, front of the eye problems and back of the eye problems. Now, you can see vitamin A deficiency in the United States, but it's usually in folks who either have a severe liver problem, which is where, you know, vitamin A, which is very, very, very important for vitamin A metabolism, or cirrhosis of the liver and things like that, or folks who've had a gastric bypass where they have problems absorbing vitamin A. So that's the kind of developed world, version of vitamin A deficiency, as opposed to, the low and middle income world version of vitamin A deficiency. So vitamin A is probably the most important one. Other ones matter, of course, but vitamin A and its kind of relatives, if you will, lutein, beta carotene, and things like that are among the most important family of vitamins for ocular health.
Got it. So what's the big verdict on screen time? Because I know that that's something that's huge, especially now with, small children. Everyone's always really worried about how screen time can affect eye health and mental health as well, of course. So what's the stats on that? Do we have to be mindful of it?
Yeah, as a general rule, you can't hurt your eyes by using them. People often talk about, eye fatigue, and kind of implicit in that is the analogy to muscles and strength, and joints and things like that. And, the eye is an organ of sense. So the same way you can't, smell too, and I'm not being glib, you can't smell too much or hear too much. Um, by routine use, it's, there is no meaningful challenge to the health of your eyes. So this issue of screen time gets a lot of play. I suspect you'll get brushback from, my saying that from the people who disagree with me. But in general terms, there are other reasons to be concerned about screen time, but harming your eyes really isn't one of them. If you have dry eye, when we focus on things on computers and screens, our blink rate goes down. So if you're a person with dry eye, you may find that you have a little bit more, discomfort reading for long periods of time. You can certainly become fatigued in a general sense, for lots of time, at the screen. But the notion that using your phone is going to harm your eyes, the notion that watching television is going to harm your eyes, and things of that nature are largely misplaced.
Got it. And what would you look out for if there's like small children? For example, I feel like more often than not, I see a lot more young kids running around with glasses on than I did when I was a kid. And I don't know if that has anything to do, well, I mean, you can tell me, but I don't know if that has to do with the screening is better now and people are more aware, or I guess my mom would chalk it up to it's because they have more screen time now. So what are things to be watching out for? And is it true that we're kind of having more children nowadays wearing glasses and contacts and things like that?
Yeah, so this is actually a great, sort of a topic in terms of interest. It also, sort of fair warning, is fairly controversial.
Mhm.
But I think the main issue, if I can kind of speak to the spirit of the question, is the uh, impact of current activities on the development of myopia. And myopia is what you were talking about. I suspect, that when you weren't being able to see the board because you could see well up close, you just couldn't see far away. And that, by definition, is nearsightedness, right? You're reasonably well sighted close up, and you're not able to see far away. And so there is a fair amount of discussion and debate about, in candor, I think more it is about being indoors and not having an opportunity to, focus far away and things of that nature, and the impact of that on myopia. Now, all of that myopia development, there's also been a line of interest and research into dim illumination, reading without good lighting, and its impact on myopia, and so forth. I will say that the issues in terms of cause and effect really have not been fully resolved, and overwhelmingly, the greatest impact is more genetic predisposition than anything else. And we know that myopia is, much more common in certain Asian populations. For example, I believe the highest incidence of meaningful myopia, like 20 to 30 units of nearsightedness, which is a lot. Like most folks will be, 3 units of nearsightedness or so if they're nearsighted, 2 to 5, that kind of thing. High degrees of nearsightedness you'll see in Singapore, for example, in particular. So there are certain pockets that have a high genetic predisposition of myopia, and those things really matter much more. There is debate about environmental factors, as you're mentioning, and it isn't. It's near work generally, having things, uh, uh, for long periods of time in close proximity for folks to focus on.
Got it. So do you think that there will be some impact for all of the COVID babies and kiddos who are in quarantine and kind of staring at their walls? Or do you think that's not going to be the case?
Well, maybe, although in candor, I think that's probably not the most important impact that COVID has had on
Yeah.
on kids. I think the developmental and social, impact has probably been much greater
Yeah,
than
absolutely.
relegated to screen time.
Yeah. Switching from pediatrics to more geriatrics now.
Hmm.
I know you kind of mentioned already like diabetes, macular degeneration being one of the things that you work with. Do you have anything to like, I guess, tips, tricks, best practices for eye health for people who are older, trying to look for more prevention, things that they should be thinking about, talking to their doctors about?
Yeah, that's a great question. And so Um, let's talk about, common things. I think that cataract is a fairly common phenomenon, and in some regards, it's the way the lens in the eye ages. So for most folks, it's not a question of whether you'll develop some measure of cataract. It just comes with the passage of time, as does, as do gray hair and wrinkles. Not everyone who has a cataract has a cataract, which generally means sort of gradual opacification or clouding of the lens, if you will. Sometimes it's so subtle that folks will be in the 70s and 80s and not require cataract surgery. More generally, though, it comes to the point where, particularly in the evening, folks have a problem, say driving at night while it's raining, when the contrast is flat, because the way the cataract affects your vision eventually is like wearing a pair of sunglasses all the time. And we all know from wearing sunglasses, there's certain lighting circumstances where they're great, and other circumstances where the first thing you want to do is take them off, of course. So cataract development isn't something we can impact on right now. So, as they develop, your, ophthalmologist or optometrist will talk about your suitability for surgery. Glaucoma is a silent disease, kind of like high blood pressure. You don't often know that you have it, and yet it can steal vision from you. So, and its incidence increases with the passage, with age, with the passage of time. So I think most folks over 40 should have an annual eye exam to monitor for age-related things, and probably the kind of uh, the biggest thief, that can take something away from you without your knowing it, would be glaucoma. Um, and then there are folks who have predispositions by virtue of other conditions they have. So if you're diabetic or you're hypertensive, and as you know, you can be a diabetic in childhood as well as in adulthood, but with age also, diabetes is more common. They'll need to be seen on a regular basis for monitoring of their conditions and an opportunity to intervene before the disease takes vision away, right? It's always easier to cut things off at the pass than it is to rescue things that are at risk of being lost. And if you have a family history of conditions like diabetes or macular degeneration, it also behooves you to get, routine care. So I think to bundle that all together, I think, by the time you're age 40, if you haven't had, if you've had great sight your whole life, you probably still need to start to plug that into your health maintenance program with an annual eye exam.
Yeah, 40 sounds like when everything goes downhill. I'm kidding. No, this is great. I'm really happy that you mentioned that. And I think that just even everything, right? Like I'm a huge advocate of everyone should get an annual physical therapy exam. I wish they had something like that. It's just a movement screen, making sure that you're moving well. And I feel like, we do that for general systems, but when we go for our annual physical, they're checking our blood work and they're checking our heart and they're checking our lungs, but they're not necessarily checking your eyes and other aspects of our body that, are really important and vital. So I'm huge on getting those preventative checkups. I think make a huge difference and hopefully insurance covers them. I'm pretty sure that they do those annual eye exams. I'm pretty sure most major insurances cover them. So I think anybody who's listening, if you haven't already, you can usually go onto your insurance carrier's website and then, kind of figure out which doctors are in your area who, can take your insurance and book an appointment because I think it makes so much more sense to catch something earlier on than have to wait, like you said, for rehabilitation. Prevention is always the best way.
It's really absolutely true. Even if you kind of catch it and you fix it, broken and fixed is almost never the same as not broke, right?
Yeah.
So the prevention thing is very, very big. Time and again, folks will say, "Gosh, this was bothering me. I should have taken care of it, years earlier." Not only in terms of the outcome, but also in terms of the quality of life that they would have had it been addressed earlier. So it just underscores the point that you're raising. It really makes sense to
Hmm.
take care of things in a with a preventive sort of orientation or perspective.
Yeah, and speaking of the, you never know how much better the quality of your life was. I vividly remember putting on the glasses for the first time
Right,
and being like, "Oh my
right.
God, I'm blind." It was so weird to like have that, to be able to see properly after a long time. Um, this is wonderful. Tony, do you have anything else to add to our conversation or anything else that you want to share with our audience that you feel like you haven't yet?
Gosh, I think we've covered a lot of good general topics. I think maybe one topic that might be of interest, a general topic for your audience, if you want to touch on it briefly, is uh, either contact lens wear or laser correction surgery. Those are two sort of fairly common things, and um, for contact lens wear, I think one thing that most folks don't think of is how old you have to be before you can wear contact lenses, and it really has to do with when the person is sort of mature enough to kind of maintain all the hygiene aspects of it. Contact lens wear generally is a fairly, kind of benign thing, but, you can get, infections from contact lenses. I will tell you that probably the best sort of paradigm is a daily wear lens, if you can afford it, because they have the highest oxygen transmission coefficient, so it's healthiest for your cornea. Uh,
Hmm.
and I can tell you that no ophthalmologist sleeps in their lenses overnight, so the whole issue of contact lenses being slept in is generally not a good thing. And if you do end up happening to do that, if you're wearing a daily lens, that's usually the best scenario because of the high oxygen transmission. And kind of another topic, or in a similar vein, talking about refractive surgery or LASIK surgery. In general, it won't be offered to someone who's under 18, but in candor, if you think about yourself as a nearsighted person, your glasses probably kept changing until you were in your mid-20s. But 25 or 26 is when skeletal growth stops, and that's when ocular growth stops, and that's when you're finally physically all grown up. So your glasses won't change anymore. So if you get LASIK surgery when you're 18 or 19 or 20, then the procedure, your eyes will be a different power 4 or 5 years later. So while you can get it, before age 25, I usually advise folks to, wait until they're in their mid-20s because then the fix will stick, you know, probably until you're, in your mid-40s when your eyes start changing again because you need something to help you read.
Yeah. Do you feel like there are any major side effects or negative consequences of getting the LASIK surgery, or do you feel like, they've kind of nailed it and it's pretty safe to do?
I think the procedure itself is safe. There are certain populations of patients who maybe are not ideal candidates. So if you have a predisposition for dry eye, for example, that can be made worse as a
Mm.
consequence of the LASIK surgery because it does interrupt some of the nerves that run in the cornea. And so patients with dry eye, patients with conditions where they take um, uh, require steroids, for example, because steroids can impact on healing. Severe diabetics maybe are not, great candidates. So there are some certain subpopulations that it's not because the procedure isn't a good procedure. I think it technically has been quite highly refined. It's that they themselves are not good candidates. Their eyes not good substrate for the procedure. And so anybody doing the work should have a thoughtful conversation with a patient about eligibility based on those issues anyway, but just for folks thinking about it. And the other, what LASIK surgery fundamentally does is it lathes your cornea in much the same way the lens in your eyeglass is lathed. And also people who are very, 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 very nearsighted have a thin cornea already, and the amount that they would need their, you know, um, cornea lathed is not compatible with the thickness of the cornea. So lots of times I'll get a question from someone who is super nearsighted, like, hey, am I a good LASIK candidate? And the answer is no, you're sort of out of the sweet spot. You're a little too nearsighted to be a good candidate. All those things would be covered, by the refractive surgeon, but folks who are just pondering it, sometimes ask
Yeah, for
along those lines.
sure. This was so informative. I actually learned so much from this conversation. I'm so happy, Dr. Antonio Capone, folks, who came in, gave us so much of his time, going back and forth, scheduling even. Thank you so much for educating our audience, for educating me. And I hope we can have you on the show another time to talk about like an adjacent topic or something more interesting in the future. But thank you so much.
I'd be delighted, Sneha. It's nice to meet you. Thank you.